In terms of how we involve the family as part of that discussion, for us, we do it early on and we just try and have a high level of transparency throughout the entire process. Around the 1 month mark of someone's stay at the Commons, we present our clinical recommendations, which oftentimes does include aftercare recommendations. And if that includes a recommendation that the participant continue on into ACT, we would make that recommendation there, and the participant and the family would be able to ask questions, give their own opinion, seek clarification from both the treatment team and the provider at that period. And assuming that everyone is on the same page and wants to move forward into ACT, we would have the participants gradually start to join ACT programming, and we'd also introduce New Hampshire care management staff into some of the family calls that happen. So that way the family would be able to ask questions about, well, what does my son's day look like when he's in ACT? What are the protocols? How does this work? And the participant would also be able to ask these same questions. But we just try and make it as gradual a process and as safe a process as possible. So.
Yeah, I think one of the things that we tried to talk about, and you reminded me in how early we have some of these conversations, is really just that this is a process and It's a journey. It's not an event. And so as anxious as participants are sometimes to end residential and move on to the next step, I think we do a lot of laying the foundation to help them recognize that it's one step at a time, and we're doing things side by side with them one step at a time, and really emphasizing the role of the relationship by starting to integrate members from the ACT team, the Assertive Community Treatment team, into their care. So it's more about a process of transition rather than all of a sudden one day you're in residential and the next day you're out in the community.
And there is a very transparent process to it. There's, to be frank, there's a checklist, and we say, hey, before someone transitions, these are the things that we have to get done.
Yeah.
And we don't keep that a secret. We let everyone know, the participant, the family, and we have them be a part of it. And we encourage them to be active in their transition.
Yeah.
So, but it definitely is a process. We don't want to have a shock to the system.
Absolutely.
So.
Yeah. Marathon, not a sprint, right?
Exactly.